Welcome to the Introduction to Ultrasound video for the first year course in Human Anatomy and Embryology at the Geisel School of Medicine. The purpose of this video is to provide you a brief introduction to performing ultrasound and show you a few tips and tricks. Throughout the video, we will show you examples of the various techniques you will need to master to complete the ultrasound assignments for the Human Anatomy course. The first step is to get comfortable using the probe. The probes are delicate, so please be careful not to drop them. It's important to appreciate the orientation of the probe with respect to the screen's image. Most ultrasound probes will have a marker near the head of the probe that will correspond to the marker on the screen. On the Mindray ultrasound unit used in anatomy, the probe has a small bump that corresponds to the M on the left side of the screen. If you are ever unsure about the orientation, you can always place a little gel on one side of the transducer surface of the probe and wiggle your finger in the gel. This motion will show up on the screen and will let you know how you are oriented. When placing the probe on the phantom, hold the probe as you would a pencil, pinching it between your thumb and fingers. One of the most important steps is to stabilize your hand, wrist, or arm with respect to the patient, so that you will not lose your position if the patient moves. The gel is also pretty slippery and it's easy to lose your position when you focus on the screen. The easiest way to accomplish this is to place your third, fourth, and fifth finger on the patient. This way, if the patient moves, you will move with him. When using an ultrasound, it is important to remember that even small movements will change your image drastically. When you first place the probe, you will likely be in the general area you want to examine, but likely not have the optimal view. To optimize your view, try to avoid large movements of the probe. Instead, focus on three basic movements. The three basic movements are tilting or rocking the probe along its long or short axis. Alternatively, you can slide the probe up, down, left, or right. And finally, there is a rotation along its central axis. To look for an artery, place the probe perpendicular to the phantom, and then slide left and right until you can center an artery on the screen. Here is a picture of our vessel from our phantom. We can localize ourselves with respect to the marker on the probe using the Mindray logo on the top left of the screen. This is the image closest to the marker, and this is the image on the other side of the probe farthest from the marker. The top of the image is the superficial skin. The bottom part of the image is the deeper structures. Here we can see the artery. We can use this image to measure the transverse diameter as well as the AP diameter of the vessel. The goal of ultrasound is to find the right image. Usually this is done by starting with sliding motions. Here you can see sliding up and down following the arteries. Sliding will change your image drastically. Therefore, when you're close to the image you want, you need to switch to a tilting or rocking motion. Here we can see how tilting allows you to study the branching point of this artery in much finer detail and more controlled fashion than sliding did. Thus far, we have imaged the vessel on the short axis. To switch to the long axis, you want to rotate your probe along its central axis. You want to do this slowly and trying to maintain the vessel on the center of the screen throughout. Don't forget to adjust the depth of your image. Every time you're using ultrasound, you want the structure you're focusing on to be on the center of the screen. So in this case, you want to zoom in on the vessel and bring it closer, like so. The focus point is marked by the arrow on the right side of the screen. Moving the focus point will improve the image at that level. Here you can see it change as we move the focus. Keep the focus on the image you are most interested in. We're now going to move on to the torso phantom. When imaging deeper structures, you want to switch to the curvilinear probe. This is the probe with a curved edge. Again, hold it like a pencil between your thumb and fingers, stabilize yourself on the patient. Here you can use the different types of motions, rocking and tilting along the short axis. This is an exaggerated movement to make a point. Really what you want to focus on is small, slow movements. Here is rocking and tilting along the long axis. Again, on a real patient, use small movements. Finally, you can slide up and down Normally you would want to do this slowly or slide left and right. The last movement is the rotation. You want to rotate along the central axis of the probe. Normally when doing this, you want to have the image you're interested in at the center of the screen and rotate slowly, trying to keep this image in the center so that you don't lose it as you as you move the probe 90 degrees. The curvilinear probe still has the marker icon on the top left of the screen. This corresponds to the area of the patient closest to the marker on the probe. This is the area farthest from the marker. The top of the image is still the superficial tissue, and the bottom of the image is still the deeper tissue. Lastly, to make it so that everyone's imaging looks the same, there are some conventions. When imaging the patient, always place the marker onto the patient's right side of the body. When imaging sagittally, you will want to place a marker facing the head of the patient. Similarly, when you are imaging an extremity, such as an arm, you want the marker towards the head or towards the right side of the body. Thank you for watching. I hope you learned something, and special thanks to Dr. McNulty and the Anatomy Department at the Geisel School of Medicine.